We have three fantastic speakers today. First of all, we have Mark Ezzell, who is Director of North Carolina Governor's Highway Safety Program, Elyse Keefe, the Road Safety Project Coordinator with the University of North Carolina Injury Prevention Research Center, and Leah Shahum, Founder and Executive Director of Vision Zero Network. So with that, I am going to stop sharing and hand it over to Mark. Oh, Mark, you're on mute.
Okay, how's that? A little bit better?
Much better.
Thank you all very much for the opportunity to present today and talk about a great project that we've done in North Carolina. First of all, let me start off by thanking you all also for reaching out either to me directly or to many members of our team about North Carolina and the devastating floods that we have dealt with and continue to deal with in the western part of our state. We're making great progress largely as a result of the generosity of many of you on the call and other folks across the country. So thank you very much for that. So let's talk a little bit about the North Carolina Vision Zero Collaborative. So Elyse Keefe, who is the project manager of this, is also here, and she now is working behind the scenes helping us with our the PowerPoint. So Elyse, let's go to the next slide. Great. So let me start off by telling you a little bit about the history of the Vision Zero project and our particular spin on it with this statewide community collaborative. So in 2015, before I started, then Governor Pat McCrory declared North Carolina a Vision Zero state, which is great. I'm going to be honest with you. I think it was largely declared because Vision Zero is a really good slogan. And I'm not sure that everybody read the fine print in 2015. So we adopted Vision Zero in North Carolina as part of our strategic highway safety plan. And this was also something that was declared by the governor. But I don't think we had a good idea of what exactly we were getting into. In 2016, the governor's highway safety program began funding one aspect of Vision Zero that still continues, and that is the Vision Zero data analytics effort. It was essentially taking some of the existing data that we have, creating a large and usable website that helped compile that in a manner that was going to be useful to local communities. In 2017, when Governor Cooper came on board, it was elected in 2016, inaugurated in 2017. I came on board as director mid 2017. At that time, that's when we really got started with a couple of interesting things. One thing we had was a member of our DOT board who was from Robeson County. Robeson County is a very poor county toward the South Carolina border, which has a large number, for such a rural county, a large number of traffic fatalities. This board member was very interested in getting community engagement around traffic safety to address this public health crisis. So, logically, let's pin Vision Zero. Let's try to put together a Vision Zero community in Robeson County. So we did that. We also, when I came on board, I had some previous experience in public health and doing community engagement there. One of the projects that I worked on was a tobacco-free schools project. 20 years ago, tobacco, very much the backbone of North Carolina's economy. I ran a project where we got all of the state's school districts to individually adopt no smoking policies on their campus. Sounds easy now, was not easy then. But using that experience, we were able to see how useful it can be to have community advocates really working on collective change, and how that having one community working on an issue can spur other communities to do the same. So using that model, we took the existing grant that we had, the Vision Zero Analytics grant, and added to that to create the Vision Zero Community Collaborative. When we funded that in 2017, 2018, there were 4 Vision Zero communities. And so some communities had been early adopters, not all of them were. So in 2019, we actually split our Vision Zero project that we were funding into 2, one specifically around community engagement, the other around the analytics work. Our good friends at UNC, who you'll hear from later, are doing the community engagement project. And then the analytics and data work is done by NC State. And we also created some Vision Zero milestones. I'll talk a little bit about those in a minute. We created a planning guide, really got going. In 2021, we created the Vision Zero statewide task force and also put together the first Vision Zero Leadership Institute that Elyse will talk about a little bit more. And right now we have 29 communities which are involved with the Vision Zero Community Collaborative. So a lot of growth, a lot of potential. Next slide. So what constitutes a Vision Zero community? You know, we knew that in building community engagement work, communities can often be kind of all over the map. And so we wanted to honor that, and we wanted to respect that, and we wanted to have as inclusive a 10 as we could in counting what we said is a Vision Zero community. So we talk about milestones, but working with UNC, we actually developed some milestone markers. The first is the exploration phase. These are communities that have heard about Vision Zero, they want to get involved, they don't know exactly what to do. The second is the installation phase. That's where oftentimes they are already creating coalitions. They're in the process of building a plan. They're trying to install things, really get the structure together to make Vision Zero work in their community. And then finally, we have several that are in the implementation stage. They've already put together their plan, and now they want to make the plan work. And so they're finding financing, they're finding tools, they're finding other opportunities to really make that happen. So we wanted to honor and respect people in all 3 of those phases. And let's face it, this is difficult work. I'd love to say it's all linear, but sometimes if you're in the installation phase, you go backward. Now these things happen when personnel changes, and there may be some changes in the composition of your community group. So folks sometimes can teeter between all 3. Obviously, we want to get them in the implementation stage. Next slide. I mentioned this earlier that in 2018 we had 4 Vision Zero communities. Next slide. And now we have 29 of them. And so you can see them scattered all across North Carolina. Again, different levels of engagement, but they all are Vision Zero communities working as a team, taking advantage of the resources that the Vision Zero Community Collaborative provides. And what are those resources? That's on our next slide. One of the principles that we've got is, well, let me back up. When we created this, we wanted to make sure that there were certain principles that we wanted the good folks at UNC who are doing this Vision Zero Community Collaborative to abide by when they were providing technical assistance and tools to the local communities. First, we've got to respect community autonomy. Okay. What Charlotte does as part of their Vision Zero plan can look very different from what a small community in Eastern North Carolina is going to put together as their plan. So we don't tell the communities how their plans ought to look, but we will provide some guidance on principles that they ought to consider, some milestones that they ought to meet, and also engage them with other communities that are similar in many respects so that they can share information. The second thing we expected was strong community engagement in creating the community coalitions. And so again, the Vision Zero Community Collaborative provides technical assistance on that. The ideal community working on Vision Zero is a mix of professionals and members of the public. I've got to be honest with you. One of the things that we're working on is the fact that many of our Vision Zero coalitions locally are made up largely of professionals. Not always, though. So that's one of those things that we're trying to work toward and address regularly. Information sharing is really key. We want to make sure that those communities that are engaged have ample opportunities to learn from one another. And so we have regular calls with not only members of the Vision Zero collaborative, but also other communities that might have an interest. We have the Leadership Institute that you'll hear about from more. And then finally, we wanted to create a statewide Vision Zero task force, largely to be made up of the people who can do kind of the blocking and tackling and the assistance that may be needed at a statewide level. So if there are some things that need to be done from state DOT, you've got state DOT members of that. If there are political issues that need to be addressed, you've got some people with who can engage in that area. We've got the League of Municipalities involved, recognizing that many cities are the ones that are going to want to be Vision Zero communities. And so we've got a very good, broad group of people on that statewide Vision Zero task force. So we've got all of those things. It's a good model. I'm going to now turn it over to Elyse to give you some idea of the specifics of what the Vision Zero Community Collaborative provides. So Elyse?
Hey there. Thank you, Mark. Good afternoon, everyone. Thank you so much for having me. I'm really excited to be here to talk about our project in North Carolina. My name is Elyse Keefe. I'm the Road Safety Project Coordinator at the UNC Injury Prevention Research Center. And as Mark mentioned, our team at UNC has been funded by North Carolina Governor's Highway Safety Program going on 5 years now, just started our 5th year, started last week. And so we provide technical support and capacity building to communities in North Carolina that are interested in or are actively implementing Vision Zero initiatives. So this is our team, and I'll just note from the outset, we're a very interdisciplinary group. So we've got backgrounds in public health, social work, planning, psychology, and more. So cross-sector collaboration is really central to our approach. And so we try to practice what we preach. And then we also draw on guidance and support from a few other organizations, including Vision Zero Network. So you can see those on the right-hand side here. And of course, NC GHSP. And yeah, we're just so grateful to that team and to Mark for his leadership and support of this project. So I think it's probably safe to assume you're all familiar with Vision Zero, have at least some familiarity with the safe systems approach. I've heard it described as, Vision Zero, zero deaths is the goal, and safe systems approach is how we get there. So I just wanted to kind of start with just a glimpse of how our team has approached this model in North Carolina, just because it might differ just a little bit from how some have described it. So for us, those middle pieces, those are the outcomes that we all want. So we all want to see safe roads, safe speed, safe vehicles, and all of that. But that's not necessarily how we want to organize our strategies or how we actually get it done. So I think, safe systems approach, Vision Zero, it's really meant to be a paradigm shift and a new, better way of everyone working together, working more collaboratively. And so I think if we, organize our strategies around those outcomes, we can kind of find ourselves back in those silos, right? So our team has really taken the approach of trying to focus instead on those safe system principles. So those words circling around the wheel there. So safety is proactive, redundancy is crucial, humans make mistakes, and so forth. And really trying to consider how all of us can integrate those principles into what we're doing and hopefully find new ways to work better together around those principles. So again, excellent outcomes. I think we're all in agreement about that. But just trying to think about how we're going to get to those outcomes by actually breaking down those silos and maybe even all having to kind of reimagine each of our roles in road safety a bit. Those principles can, of course, feel a little abstract. So, from a public health perspective, that's why, I think models like the Safe Systems Approach Pyramid can be really useful to help us think through and prioritize, what are those most effective strategies going to be? How are we going to get it done? And thinking about those as we're working with communities. So, what are the things that stay true to those safe system principles that are going to impact the most amount of people? And so you can see bottom levels here. I'm not going to go through this in depth, but at the bottom, these are the things that are most impactful, and they're going to be related to socioeconomic factors, the built environment. And these are, of course, the most complex and kind of systems level interventions. But these are the things that really get at the root causes of who and when and how people are exposed to risk on our transportation network. So we can see, if we're prioritizing those bottom levels, these complex interconnected issues, we're going to have that collaboration across sectors, across disciplines, agencies. We're going to need new partners at the table. And again, we might all have to kind of shift our traditional roles a bit. So a more specific look at what we're doing in North Carolina. So this is our model. At the bottom, you can see our 3 primary activities that I'll describe next. So holding peer community touch points, our annual Vision Zero Leadership Team Training Institute, and our statewide task force. And then at the top, you can see our core skill areas that our team tries to bring to bear on all 3 of those activities. So first off, our peer community touch points, and these are monthly check-ins. So we just provide communities basically a chance to connect, share, and learn from one another in small groups. So a few community teams per group. And then on a quarterly basis, we have an all-hands meeting. So that's everyone all together alongside of partners at the state level. Those meetings typically have some sort of presentation on best practices or report on something key happening at the state level that's impacting Vision Zero work. And then related to that, and along with the support from some other projects, our teams also developed several resources for communities that are related to things like Vision Zero plan development. We actually have a library of plans from across the country that we maintain and update. And then, I think you've noticed at this point, our niche is really around this cross-sector collaboration piece that we think is just so crucial for Vision Zero implementation. So we have lots of resources related to that. So learning about different disciplines and what their role is or can be for Vision Zero, as well as some tools for actually building and maintaining strong coalitions. So you can check those out. That QR code will take you to our resource hub, and I think that will be linked in the chat as well. Next is our Vision Zero task force. And that group is responsible for leadership at the state level. So Mark mentioned some of this earlier. So really trying to strategize how to remove barriers and open up lines of communication and resources to communities. On the right-hand side here, you can see some of the topics that our task force is going to be considering and prioritizing at our upcoming meeting this month. And these are kind of a subset of topics. These are things that we've kind of heard as common issues and things coming up from the communities themselves in our work with them. And then especially where there's kind of overlap between those and what has recently come out in our state strategic highway safety plan. And finally, we host an annual Vision Zero Leadership Institute, and you can read more about that following that QR code and the link in the chat. So this is a team-based training for community teams of about 3 to 6 people, and we just require that teams bring representation from at least 3 different agencies or sectors. and we hold a half-day virtual pre-session, just trying to get some of that foundational stuff out of the way. And then teams are then invited to spend 2 days in person with us here in Chapel Hill at no cost to them. We provide meals and hotels for those traveling. And to clarify, this is all funded by North Carolina GHSP. And at the Institute, we really try to keep things as active as possible. So we have a mix of speakers and panelists, but really important to the Institute is we dedicate a lot of time to what we call team time. And so this is an opportunity for teams to, take all the info and inspiration from the speakers and kind of share with one another, everything that they've been kind of working on in their silos with one another, and just really sit together and plan out how they're going to bring all this together and take it back to their community and move things forward. So these are structured activities with a facilitator, and they're using typically systems tools, and it's also tailored to the community's implementation stage that Mark was describing earlier. So these are some of the content areas we've covered over the years. Those first two, so cross-sector collaboration, safe systems approach, those have been two that we've covered every year that we've held the Institute. So we just had hosted our 4th Institute. And the other ones have kind of changed year to year. There's, of course, going to be overlap across the categories. But this year we focused on building a culture of safety and participatory planning. And then finally, I just want to share a little bit about who actually attends our Institute. So you can see we got the usual suspects, heavy on engineering and planning, but we also have advocates and folks from public health, fire departments, law enforcement, elected officials, communications, public works, and other municipal leaders that are attending as part of those community teams. So that is the Vision Zero project in a nutshell. But I would be remiss if I did not share about a new pilot program we're launching at UNC with this audience. So this is completely separate from the Vision Zero project in North Carolina. And this is a new one we have funded by NHTSA, and it is for state highway safety offices. So the purpose is to really help states learn more about public health and plan ways to integrate public health approaches and programs into their state safety planning. So 1-year training program. It does leverage a lot of what we've learned from the NC Vision Zero project, but we are now actively recruiting states that might be interested in participating. So feel free to follow that QR code and read more about it and maybe complete an interest form. So yeah, my takeaways for this afternoon, safe system principles need to be centered in this work and integrated across disciplines to achieve zero roadway deaths. The field of public health has some relevant models and skills to lend to these efforts that I don't think have been fully taken advantage of yet. And that our model in North Carolina is a unique one for building and maintaining momentum for Vision Zero. And then finally, that this transportation public health leadership program is a good opportunity to learn more about that. So thank you so much for your time today. This is my contact info, and look forward to hearing questions.
Thank you so much, Elyse, and thank you, Mark, for your presentation. That's really interesting and I think really valuable to not only the state highway safety offices that are on today's webinar, but also to a lot of the partners who are here. I really would like to invite all the panelists to turn their cameras on so we can explore these issues further. Before we get started, I want to remind everyone watching that you can use the Q&A panel to submit questions for the panelists, and we will try to get to as many questions as possible in the time we have remaining. Leah, I'd like to start with you. How do you see the North Carolina approach being a model for other communities, especially considering the role that state highway safety offices can play in advancing Vision Zero and the safe system approach?
First, thank you for hosting, and huge thanks, Mark and Elyse. Your leadership is really impressive to me. And I'm going to share, at the national level, we're looking at all these different things happening around the country. What are models? Our whole basis is how do we share things that work with others? And I think there's three key reasons that what you're doing in North Carolina on this front is really a model that I hope everyone borrows or steals or builds on. The three reasons are, number one, this focus and this funding, this effort is really beyond a single project or campaign, right? It really is, as I see it, and Elyse, you said, investing in a paradigm shift. It's recognizing that systems change needs to happen. And part of that is culture change. So number one, it really is much more holistic than just, hey, we have one intersection that needs more enforcement, or hey, we need a billboard campaign about not doing this or that. So this is really kind of a deep dive. Number two, I really appreciate that the work is diverse. It looks beyond the ease. You mentioned kind of getting out of the silos. We always say that, oh, we're moving out of silos, we're moving out of silos. But I've been part of this program. I've been really fortunate to be there in some of these meetings, and they really are. And it's not just the diverse participants in these programs, it's the diverse skill areas. And Elyse, you shared that slide of skill areas. I want to really emphasize that I think in my experience, some state highway safety offices have really only seen have focused on the ease of education and enforcement for many, many good reasons. I understand why. And yet there's such a role to play about bringing the different worlds together. So I see this as a way for a state highway safety office to really actually put into practice that breaking down barriers, silos things. And then number three, I think you're really in this program recognizing the importance of peer learning in an ongoing way. A lot of places like state highway safety offices have an annual traffic safety summit. It might be a one-day event and you bring everybody together and there's presentations and discussion, and that's fine and good. What you're really doing here with these monthly meetings and with the ongoing state task force, and you're really helping communities, whether they're transportation, public health, advocates, elected leaders, build relationships in an ongoing way. So I think that we all recognize there's no easy, like you said, Mark, this is not an easy thing. We wish we all could say, oh, great, learn this and you're good. No, it's ongoing learning, ongoing challenges. And the biggest thing I can see here is that you're setting up this framework or a network for ongoing learning and ongoing peer support and ongoing capacity building. So I really love that. And I'll just add that the other reason I think people should care about this or look into this as a great model is that funds are available. As I understand, it's the 402 highway safety funds from NHTSA that help fund this. And every single state has access to those 402 funds. So it's really, I think you guys have done a great job of thinking outside the box. And this is something that can be replicated in every state. Thanks.
I think on a similar question, or sort of to follow up on the 402 funds, and this is a question for you, Mark. I know that the 402 funds are funding the community collaborative work and the Institute, but what are some of the other types of funding that are out there that the communities can tap? And is the 402 funding also available to the community programs that are out there?
Yeah, so for the state highway safety offices interested in doing this, the 402 funds are a logical way to help fund the kind of community building that we're doing. Interestingly, I mentioned another project related to Vision Zero that we do, and that is the Vision Zero data analytics. That we fund some of that through our traffic records money. Some of us in state highway safety offices, we've got traffic records money, and it's in North Carolina for the longest time was kind of tough to get rid of because you had only a small number of people who qualified. So we were able to do some of that with traffic records. But in our case, we use the 402 money to do the community collaborative. Now, that said, let's say you want to do, I think community building is really the secret sauce of traffic safety. So if you want to do that, obviously we can use our 402 funds, but think about other organizations that might have an interest in helping fund this as well. Public health foundations that traditionally have not gotten into traffic safety work, I think they'd love to fund that kind of thing. If a number of Blue Cross organizations have their own foundations and nonprofits, I would think this would be something they would love. So take a look at some other groups that have funded other kinds of public health efforts and try to put a public health lens on this and see if they're interested in helping build these coalitions.
Thank you. Elyse, you talked about some of the needs that the people in the communities have around Vision Zero, but what resources have you found to be the most valuable for the local communities?
Yeah, thank you. Yeah, we actually did an evaluation, had a student do an evaluation last year and kind of interviewed the communities because we kind of wanted to know, what is having an impact and what's resonating. And some of the ones I put on that slide that are on the resource hub are definitely some that we heard about. So I think, those that milestones checklist, which kind of it's, as Mark mentioned, it's not quite linear, but it kind of gives you a good snapshot, and communities have found that helpful just for kind of breaking down. It's Vision Zero is so huge, right? And it feels like such a big thing. So kind of being able to break that down a little bit and knowing that you're not just going to be implementing from the start, but you kind of have to build that foundation, and so that's been helpful for communities. And then I think the other piece is that there's the technical knowledge and it's out there, right? We know what needs to be done to reduce roadway deaths and get to zero. But even just with that technical knowledge, you need so much more of kind of like soft skills. Like, how do you communicate that? How do you build that support? So we also have a media framing guide, and so that's for transportation and public health professionals. And so, it's specifically in communicating to the media, but I think there are some, we've heard from communities that we work with that it's been helpful for them to, kind of all get on message and kind of inform even their visioning and things like that. And thinking about just how in all their conversations, how they're going to kind of reframe this and keep safety as that central message. So I think those have been really helpful. And then for the earlier communities, we've definitely found that the partner identification tool is really helpful, and that's another one that's in the resource hub. So not just kind of it gives like this exhaustive list of different partners that they could consider bringing to their coalition, and all these things are going to be community specific. So that's why it's exhaustive, because you kind of want to think about, who's the mover and shaker in your community, and where's that energy. But beyond that exhaustive list, it's also kind of walks you through thinking about like, why would they want to be involved in Vision Zero? Like, what are their pain points? And kind of thinking from their perspective and preparing yourself before you really approach them and try to bring them on. So those are a few I'll highlight.
Leah, I wanted to sort of step back a bit. Mark mentioned that some of the communities are seeing challenges in getting public participation. Can you think of any strategies that other communities, other Vision Zero communities in other states have implemented to engage the public in these efforts?
Yeah, I think some of the things that we're seeing more of is doing more things kind of on the ground in the communities themselves. There's an example, right, where we invite people to meetings, Tuesday at 2 p.m. may not work for everyone. Surprise, surprise, right? Obviously there's video calls, but it really can help to be in person. So I think we're seeing more and more communities, really think, okay, we're sending folks out to that event, that gathering that this community is having and having the conversation, or, hey, we're doing some sort of pilot, kind of maybe a pop-up temporary design treatment and seeing what people think and talking about traffic safety on the ground, literally. That's one idea, is really, again, like physically meeting people where they're at. Number two is, and this is very specific to state highway safety offices, I'm really encouraged to see more state highway safety offices specifically funding community-based groups to help do the outreach and the part of the community building that Mark was talking about, right? I think for too long, it's been a little bit of this kind of feeling of like top down, and there's times for that. But what we're seeing in Los Angeles is a great example. Philly, DC, I've got some examples I can share if people are interested, but part of the work is, hey, let's fund these community-based groups that actually have the relationships with the community we're trying to get at. Say it's a certain, segment of the community that's high risk, unfortunately, because of such and such. So it's really recognizing, we can't just keep inviting people like, come to our inconvenient meeting way over here across town. How do we help really build the capacity of the community members themselves?
And let me just piggyback on that a little bit, Leah. One of the questions we got in the chat is, well, how do you start this in a smaller community? Because we did start when we started this back in 2017, we had examples, and you're right, it was from LA, it was from New York, kind of hard to fit with a small area in North Carolina. One of the things that we've seen in community building is that if you've got a community spark plug, somebody who has been impacted personally by traffic deaths, and that doesn't always have to be a community member or a person who's been involved in a crash or had family members. It can be a physician or a nurse or someone else like that who can really start this project. I mentioned Robeson County, where there's an attorney who's now a member of the state DOT board who really just wanted to take action on a major public health crisis in his community. Robeson County is a very small, in terms of numbers, a fairly small county. It's very, very rural. And so he was that spark plug. He brought together hospitals and county managers, but also brought together, clergy and community leaders and retirees to try to build that task force. So that's something to look at, to try to get those community spark plugs early.
Mark, I'm really glad you said that. We're going to keep piggybacking here. I'm really glad you said that because kind of the ultimate, sadly, tragically, sometimes the ultimate connection is someone who's been personally impacted. Either they've been involved in a crash and injured, or they've lost a loved one, God forbid. And I just want to emphasize that is a community who, if and when they want to be involved, is just such strong advocates for change, and it's so moving. And I want to mention that there's an upcoming event, annual event that I know a lot of folks in North Carolina and across the country are already part of. It's called World Day of Remembrance for Road Traffic Victims. And this is an annual event coming up November 17th. I think I said that right. November 17th. Yes. So very soon. And thank you for adding the link. This is a chance for communities of any size. You may have 300 people at a Washington, D.C. rally, or you might have 6 people at a small community event in another area. But the goal of it is to honor those who've been injured or lost, and importantly, to help mobilize for change. So please check out that link. And it's a chance where we're involved and at a national level can help with the resources. We've got things like media guides, event planning guides. You can plug in to be part of kind of the national press outreach on this. So it's a chance where, let's be honest, let's say, I'm just going to give an example that sometimes happens. Let's say your mayor maybe talks a good game about road safety, but maybe isn't stepping up to the plate enough. Maybe they're not investing enough funds, or they're not making some tough decisions about change. So something like World Day of Remembrance can really help mobilize, I would say, very passionate and important voices, help bring media attention, and really help kind of broaden that call in community, calling for change. So I would encourage people to look at that as an option. Thanks.
Thank you. I do want to get to some of the other questions that we've gotten from the attendees, and I really appreciate everyone who has been sending in questions. Mark, I believe this one is for you from Carrie in Arizona. Since you have now had the program in place for a number of years, are you seeing any related and sustained reduction in serious or fatal crashes?
That's really the key question. I can tell you that from a statewide perspective, I have not looked at all of our Vision Zero communities data, but from a statewide perspective, the answer is no. And you're like, okay, well, does that mean it's not working? No, it doesn't mean it's not working. It means this is hard. It means this is really hard. If there was a silver bullet to address traffic safety, we would have found it and done it by now. But this is like tilling the soil. We're planting something that we think is going to grow, but it's going to take a long time to grow. Community change matters if it's, sustained and something that gets into the fabric of that community. And I'll be honest with you, that's not always going to happen inside of 6 years' time. It's just not. Sometimes it'll take 12 years, sometimes it'll take 20 years, but you got to start somewhere.
Thank you. Elyse, a question for you from David in Nebraska. He says, we've been implementing something similar in Nebraska for the last 8 months and really focusing on traffic safety as a public health issue in FY 2025. I've had mixed reactions regarding some public health departments seeing the need to treat traffic safety as a public health issue, but there has been some pushback, or a lot of pushback, in some instances where the PhDs don't see it as their place to address traffic safety. What have been some best practices to position traffic safety as a public health concern in significantly more rural areas beyond offers of funding and prepared media kits?
Yeah, I'm grappling with that. That's tough. Yeah, as a public health person, it's like, how could you not see it? Yeah, I think I would direct you maybe to I'm trying to think if we have pretty sure we have a goal and action alignment tool that's in that resource hub. And I think that can be really illuminating. Again, it's it's an activity that, folks from different agencies and sectors can do together. And so everyone's kind of creating their own, what are the goals of our agency, and it kind of walks you through, again, kind of elucidating everyone's pain points, and kind of finding where that overlap is. And so I'll give you an example. We were we were using that tool with Safe Routes to School, on Safe Routes to School project. And so we had like a meeting with schools and counselors and all these different partners. And I think in that instance, it was the schools were not super engaged. They were just like, everything's on fire for us right now. It was like, I think, pretty height of COVID. And, just through conversations and bringing people together and really sitting down to think through these things, they kind of realized like, oh yeah, we're dealing with a bus driver shortage. Like that's a pain point for us. And so actually maybe investing a little bit more in Safe Routes to School does alleviate that pain point for us a bit. So yeah, I think that's a potential tool that could be used. And then the other thing I would say is, I do think public health departments can be a bit strapped on this. You could consider some other public health partners. You could consider, injury centers such as ours. Or partners at the CDC and things like that, and maybe trying to build some support with others.
Amadie, a couple of things around building some of the public health support that, to piggyback on what Elyse said, is you could also look at if the county health departments, local health departments are not engaged in this, look at some of your university schools of public health. University of Nebraska Public Health. I know the person who asked the question was from Nebraska, may have an interest in that, especially those with the specialty around injury prevention. Another place to look at is in North Carolina, at least, and I think this is nationwide, the level 1 trauma centers generally have an injury prevention expert, somebody who's full-time working on injury prevention. And I can promise you, if you care about injury prevention and you're at a level 1 trauma center, you care about traffic safety. So engaging those folks can be useful. And then a third tactic would be the county health departments usually have an association, or they have they're brought by the state health department together for regular meetings. So one potential strategy is to try to become a part of those regular meetings and, potentially get yourself on the agenda and explain how this is killing folks. And, this is a major public health issue in your state, and get their potential engagement.
And I'd love to add to bring it back to holding up the North Carolina model. And I think Mark and Elyse are very modest in what a big deal this is. One thing I'd recommend, to the question, David, is it's one thing to think, okay, we've got some public health people coming to a meeting every now and then. That's good. That's important. You've got to talk, right? You share some resources and you talk. Maybe you're doing a project or a report or something together. Good. That's a good start. I think what I love about this North Carolina model, again, this is very different than most places do it. And it is, I'm sure, a lot of work, but it is part of the magic, I think, or the secret sauce, Mark, as you said, is it's investing long-term in these relationships. It's not a one-time hit, so to speak, right? It's saying, okay, electeds and public health professionals and advocates, and of course, transportation professionals, and I'm sure I'm leaving some people out, maybe school district folks or others. We're meeting, it's on the phone often, we're meeting once a month. We're doing this one in-person gathering once a year for 2-3 days, and we're really getting to know each other. We've got ongoing work and relationships. We're part of a task force together. This really embedding, I think there's a difference between kind of inviting and doing a few one-offs and really embedding partners in a process. So I think that's part of what North Carolina is doing so well here. And I would, again, try and steal that idea and build on it.
Thank you. And also, Cynthia Birch points out in the Q&A that level 1 trauma centers are required to have an injury prevention program, which I think is a really good thing to point out. So this question is for all of you, but I'm going to start with you, Leah, sort of in the macro, and then kind of come into the North Carolina focus, which is, why is this type of program, and you kind of got to this before, particularly valuable to communities, and what kind of need does this fill that other existing efforts may not?
Great question. We could probably talk forever on this. I think the one I'll focus on is I'm going to go a little deeper into that idea of kind of silos. And this is certainly not meant to be critical. We all do it, right? I mean, you've got a transportation that gets funding and has a mission around transportation. You have a public health department who has a budget and funding around public health. And, you're looking at kind of what are your priorities, et cetera. We all know there's more overlap, right? There's more kind of connection between these things, more interconnectivity. We realize that more and more. I want to mention, by the way, the whole, the issue of equity, health equity being a huge piece of what I see as, traditionally being kind of lost in between, but really getting elevated, I think, through the North Carolina program. So coming back to it, I think right now, every state has their Department of Transportation and their state highway safety office. The feds have the Federal Highway Administration and NHTSA, and they often work together. That's great. But let's admit it, it's still kind of different worlds. There is still a siloing there. And again, this is kind of a natural thing. But I think what this program does is it's literally saying, what are all those in-between places, right? Let's talk about those every single month, right? And one more example I'll share that I think springs from that is, the fact that you all have in North Carolina this statewide task force. I can't tell you the number of times we talk to communities. It's, community X or community A, B, and C in the same state. They don't necessarily know what each other's doing. And we'll talk to each community and they'll be, kind of frustrated by the same thing, understandably. And they just don't have time to talk to each other, right? They just don't. And we'll say to them, well, actually, did you know you guys should connect, right? So and I've seen this happen a little bit with some California work too, and we'd love to build on it here. But in North Carolina, I've seen okay, these folks are now regularly meeting. They're sharing ideas. Sometimes it's frustrations or challenges. Sometimes it's opportunities. But, for example, you might say, hey, there's this state policy that's really needs to be modernized, needs to be improved on so that we can progress on our Vision Zero work. Well, hey, let's put our heads together and do that together versus each of us, kind of working individually in our silos. So those are just a couple examples that I think are really, really changing thanks to this model. And again, I'm going to say there is funding out there for this. Every single state has 402 funds. And I'll stop there.
Absolutely, Leah. I'll totally agree. You know, nobody wants to work in a silo, but everybody's funded in a silo. And so that's what's so frustrating is, well, one person can do project A with their funding, but they can't do B. The other person could do B, but they can't do C. So we have to kind of deal with that. So one of the things that we knew that we could do is try to build communities as best we can. So that's what we've tried to do with these 402 funds. There was something else anyway. I'll get it in a minute, but yeah, thanks for that point, because I don't think anybody really wants to work in this manner. They just have, because we've got our traditional ruts, our traditional areas and well-worn paths, and I would urge us to keep those. But expand on them with other out-of-the-box things.
And I'll just piggyback a little off of that. Speaking of the task force, and I mean, there's nothing more humbling than, you know, trying to coach communities about building a diverse coalition and sustaining it, and then like doing one on your own. You're like, oh yeah, this is hard. So it's, you know, that's one piece of our project, and I feel like we're still learning as we're growing that. But maybe just to kind of plug, you know, we've grappled with the question of like, you know, what is scalable from this, or are there just like, we've got these 3 big activities and things can be like, this project can be pretty intensive. But back to what Leah was saying about just, you know, the communities are kind of all grappling with the same thing. I think we're all in the same room together, kind of realizing that there is this kind of cohesion and interest around some of these things that need to change. And then also just like, you know, that's on the kind of the macro level. And then even smaller though, you know, a lot of communities right now, there's just these themes that come up. So a lot of communities were trying to, you know, redo their traffic calming policies to be more equitable and to not, you know, just be listening to the squeaky wheel and stuff. And so, you know, we ended up, one of those quarterly meetings was just a panel from the communities that were kind of grappling with this and describing ways that they had gone about redoing those policies. So I think, you know, I cannot guarantee that is just like an effective thing that can be pulled from this project on its own. But I do think that communities have benefited from just being brought together in those ways.
Thank you. Mark, if another state wanted to start up a similar program to the Community Collaborative, where would you recommend they begin? And is there anything that you did that you would do differently if you were starting over?
Yeah, a few things. First of all, where I'd start is, first of all, getting some idea of what Vision Zero communities you already have, and do probably a needs assessment with those communities. The second thing is probably look at who's received SS4A funding and do a needs assessment with those communities. And if they say, well, we need to do a little more collaboration, we'd like to find out how to complete X, Y, or Z, well, then that may be your signal to put together a statewide project. I will say that, and with UNC, we've been very fortunate because Elyse is fantastic at what she does around community building. So we went through a university partner, and I'm glad we did that in this case. You may want to look at other partners like a nonprofit that does community engagement work, but has never done transportation. You may want to go that route to try to fund that nonprofit to do more transportation community work. Or you may want to do what we did, which is go through a university that has done transportation work in the past and sort of build their community skills. So either of those tactics, I think, is potentially useful. I would probably try to do what you can to get some of your elected officials involved early on. That's not just legislators, but that's also city council members. That's also appointed officials like members of your your planning department's probably going to want to be engaged anyway, your transportation department, but most towns and cities have a planning board. And so some of those folks may be being involved, get physicians involved. I would make sure that you do that. I can't say that there's a lot, there's certainly a lot that we've learned, but there's not a lot that I think I would do differently. Every state is different. It's like state highway safety offices. One of the great things about going to GHSA is you get to learn how others are set up, and they're completely different from yours. And it's like, that's an interesting model. So the way each state does this may differ, but we are happy to provide any kind of technical assistance, copy, steal, modify, do whatever you want to try to duplicate this.
Great. So we are almost running out of time. So let's end with a lightning round. What would you suggest the next step is for communities that are interested in exploring something similar to this? And I'll start with you, Mark, and then we'll go to Elyse and then to Leah.
I would say, make it, get a sense of what the assets are already and what the needs are from the communities, try to get them engaged. I also would say one additional partner that you might want to get is the association of your cities or towns or your counties. And so that would be a group to look at.
Okay, Elyse?
Yeah, I kind of second that. Yeah, just kind of doing a kind of assessment within your state of, who is currently on board and working on this. And then I'll just do another plug for the Public Health and Transportation Leadership pilot program that we're going to be leading.
Okay, and Leah?
Yeah, I would go read everything you can about North Carolina's program because there's so much there. Again, so much we didn't even get to. But then concretely, I would say, hey, if your state does an annual traffic safety summit or some sort of conference like that, again, it's usually a day or so, think about expanding on that. Maybe you still do that, but only so many people can travel and be there in person. What if you applied for some funds from 402 and developed out an ongoing annual, say, peer exchange, capacity building model? Maybe it's not as robust right away as North Carolina's. Maybe it starts with monthly calls amongst Vision Zero leaders, and maybe it builds. So I think that's something that could be kind of transitioned pretty quickly, or over a year or so.
And then I would say, Amadie, these Vision Zero communities can also help with your PP&E. I'm telling you, they're doing a lot of that public engagement already. So this can be another tool in the toolbox.
Thank you, Mark. So that is about it for time. I want to give huge thanks to Mark, Elyse, and Leah for this really interesting and I think valuable conversation about not only a great program, but some of the ways that we can expand it outwards into other states and communities. I want to remind everyone who is on the webinar that a link to the recording will be sent to you in an email tomorrow afternoon and will also be posted on the GHSA website along with the slides that Mark and Elyse shared. We do have several more webinars planned for this fall, and the next two that are coming up on October 22nd. We are partnering with the Association for Commuter Transportation Act and the National Association of City Transportation Officials, NACTO, on a joint webinar on safe travel to school featuring programs from Washington State, Cincinnati, and Washington, D.C. And on October 29th, please join us for another GHSA webinar on cultural considerations for impaired driving enforcement in tribal communities, with a look at how the Miccosukee tribe in Florida has implemented roadside oral fluid screening for drug use. All of our upcoming webinars and links to register for them can be found on the upcoming events page on the GHSA website. Final thank you for joining us today. Have a safe and good rest of your day.